Hi, welcome to the Fit and Healthy Today show. I'm your host, Heike Turchiano, and today I'll be presenting a segment on diabetes. First, I'd like to get through some of the technical kind of information regarding diabetes. There are two types of diabetes. First one is type 1 diabetes. It usually occurs at childhood. It's called juvenile diabetes. It's insulin dependent. It's where the pancreas does not produce adequate amounts of insulin. The most common form of type 2 diabetes, and the one that we're going to address the most today, is insulin resistant diabetes. 6 to 10% of our population has type 2 diabetes, with about 15% of the adult population. So it's an ever-growing crisis in our country. Insulin resistance, every muscle and liver cell, every cell in the body actually requires glucose to supply energy in order for it to perform its basic functions. The problem is with type 2 diabetes, these cells become insulin resistant. Insulin delivers glucose into the muscle tissues, the nerve tissues. Well, when you become insulin resistant, the muscles and the liver just don't respond to the insulin anymore, and then the blood sugars rise. So that's the kind of the technical type of stuff. The risk factors involved with diabetes are many, but these are probably the most common ones that I see every day. Heredity. Generally, when I see grandparents or parents have diabetes, oftentimes we'll see an earlier onset of type 2 diabetes. I also see it with people over the age of 40 more commonly, because they've eaten diets high in sugar, their exercise tends to be lagging, and then tend to have higher amounts of stress, which kind of mess around with their hormonal imbalances, that type of thing. Race is also an issue when we talk about risk factors. Black Americans are 2.5 to 3 times more likely to have type 2 diabetes, which is, and that seems to be an epidemic among the black population. When we're talking about things that we have control over, some of these other things we have no control over. The diet and the obesity rates in our country seem to be contributing majorly to the diabetic epidemic. Nutritional deficiencies, because the diets are, gee, I'm going to go off to fast food, got to race home, got to take the kids off to soccer practice. And as a result of that, we're finding that people are becoming very, very nutritionally deficient. They start gaining the weight, ever-expanding waistlines in both males and females. And what happens then is these fat cells hold 300 times more insulin receptors. So what that means is it blocks the body's ability, or the muscles, to absorb this insulin and sugars necessary to help the muscles and the nerve fibers work. So that's why oftentimes when we see people drop weight, we'll also notice too that their blood sugars will come down. The fat also blocks the circulation to the muscle tissues. So what happens then when you block that ability of the sugars to be able to reach the muscles is you end up with being very tired, the energies are low, you're going to get a rise in blood sugars, and you're just going to feel lousy. Then you end up with these types of things. Okay, these are the effects of what we see in diabetics, and they can start out relatively minor and then they rise with time. Initially, when you have diabetes, you may notice you get a little bit dizzy. Your blood sugars just kind of move up and down. They'll rise from extremes to lows. And under those circumstances, then people will sometimes grab sugar to kind of feel better. They'll notice they'll start urinating more. They just don't feel as good. They start gaining more weight and storing it usually around the middle areas. What we see with time occurs in diabetics is, and this is kind of a warning sign that's going to happen to you if you decide not to handle your diabetes on some of the things that I'll discuss later on. Neuropathy. That's where literally your nerves start to tingle, sometimes in a very painful fashion, and then eventually you can't feel anything at all. I see quite often a lot of issues with bladder, where people don't even know when they're fully emptying their bladder. They end up with a lot of digestion problems, to where their stomach doesn't even realize that the nerves won't even respond, so that the food can move on to the small intestines. So they end up with a lot of digestion issues. When you have high sugars, the sugars kind of eat away the vascular system, kind of like battery acid to the vascular system, and it causes vascular inflammation. That means the arteries become very, very jagged. They're not their nice, usual, smooth type of, like they should be. Well, what happens then is you get something called arteriosclerosis, okay? That's a buildup of cholesterol, inflammation in the vascular system, and then of course 2 mineral deposits can lay on that vascular system, causing the arteries to narrow with time. Well, what then happens then is the circulation, or the blood circulation, narrows as well, and as obviously when you cut off the blood supply, then we see strokes and heart attacks. You can end up with generally anywhere from 2 to 3 times a stroke and heart attack risk when you have diabetes, because of all this vascular inflammation. When we combine poor circulation and nerve damage, look what we got here. We got impotence. So gentlemen who are coming to me in my stores saying to me at 35 that they're already having issues, and they've been a diabetic for 5 years, this is a side effect. So anybody who knows they have a family history of diabetes needs to be readily aware that this can be a side effect that will come with diabetes. Eye disorders or circulatory types of issues with eyes. What happens is the eyes have these small little capillaries and little nerve fibers that send and communicate and circulate. Well, what happens then is, as we talked about, we get a narrowing of the vascular system, and when we get that, then that narrowing and then the damage to the vascular system, the eyes just don't get the circulation they need. So you end up with an increased risk in cataracts and other retinal disorders. So oftentimes with diabetics, I find one of the first things they claim or they know is, gosh, you know, I just don't see as good anymore. And I'll hear them say that, and I was like, okay, now how are your blood sugars doing? So that's probably one of the very first things I see as well. Mania, mood swings, anytime anybody's blood sugars are going all around or every in which direction, up, down, or extremely high, you're going to see a fluctuation in certain types of brain neurotransmitters and circulation to the brain itself. So it can cause mania, mood swings, thus necessitating maybe psychological evaluations and medications as well. So one thing leads to another. Since diabetics have such poor circulation, the increase in infection and the inability for wounds to heal is phenomenally increased. I mean, they can scratch themselves and it can take weeks to heal, or months, whereas with us, you know, 3 or 4, 5 days, we're healed up. So obviously, then the whole purpose behind this lecture is when you have diabetes, your lifespan and your quality of life, as you can tell, dramatically drops. And so what I'm going to try to seek to do on this show today is to give you some hints on how you can lower the blood sugars and maybe reduce some of your, at least your diet and your weight risk factors. Okay, diet, major. Nowadays, everything in our society seems to be so quick. Kids are sent out the door with a bowl of cereal, the Pop-Tarts. Mom and dad are grabbing the cup of coffee and a donut going out the door. And we're talking about very, very poor nutrition. And these nutritional deficiencies over a period of time, the body breaks down. We only have so much to go off of, and if you don't feed it, it breaks down just like a car. So the diet is very, very vital. When we talk about diet with diabetes, and probably one of the biggest hints that I can give is whenever you eat a carbohydrate, and it should not exceed 150 calories, I would strongly encourage using such things as protein, eggs, tuna, Meat. There are options for protein, cheeses. So like a sample breakfast in the morning is if you want your slice of toast, then have a couple of scrambled eggs and 6 or 7 almonds or walnuts to go with it. You've got some fats and you've got some proteins and a little bit of fiber to slow the sugars down. The key is when you go out the door with all those carbohydrates, you send up the blood sugars, and then once again, then you have the issues with those side effects that I mentioned. So a sample lunch would be something like a nice big salad with some chicken on top. If you want to have an open-faced sandwich, pile it high with all the meats and onions and lettuce, all the good stuff. Maybe just sticking with the one slice of bread. So once again, I talk to people who follow the old food pyramid diet, and basically, I mean, they're getting 8 to 10 servings of carbohydrates in one day. And for a diabetic, I call that death mode, because what you're doing is you're keeping those sugars in an elevated form, and over a period of time, it's just going to cause more and more vascular and cellular damage. So very, very important. Just if you could just simplify as much as we possibly can. Whenever you eat a carbohydrate, have a fat and a protein or some source of fiber to slow the sugars down. So if you're going to have your good old trusty apple, which is great, fiber, have a scoop of peanut butter to go with it. Something to slow those sugars down, okay? Exercise. I have a lot of customers who love to walk the Mission or get out and walk the hills, and it does help to lower the blood sugars. I have physicians recommending that their patients get more exercise to help lower their sugars and hopefully drop off some of the fat that contributes to this insulin resistance. What we're finding, however, though, is besides what is called aerobic exercise, that's, doing a good walking pace where your heart is moving but you can still talk, they're finding that anaerobic exercise, and when I saw the statistic, I was pretty amazed, 34 times more glucose is consumed than an aerobic exercise. So if you've got a local gym or you have a gym at home, or any type of resistance training, and another segment of our show, I'll show you a couple of exercises having to do an example of resistance training. That's where you're doing spurty types of exercise, where the heart rate really starts to go up and then it relaxes and then it goes up. So good old wind sprints are anaerobic, but weight training is probably one of the best anaerobic exercises. As far as medications, I'm not going to get into too much in that direction, because that's something that you have to discuss with your doctor. But I can say this, they do come with their side effects, and lifestyle changes, obviously either solely or in combination with medications, you'd want to discuss with your healthcare practitioner. Supplements. Now, I'm working on my doctorate in naturopathic medicine, and I want to review just a few supplements that I think could help you with your blood sugars, whether you're pre-diabetic or you're actually diabetic, be it type 1 or type 2. A good multiple vitamin, high in B vitamins. Those B vitamins really help reduce vascular inflammation. And there's certain tests that your doctor can run called CRP, C-reactive protein, and homocysteine that can check for some of this vascular inflammation, but the B vitamins really do help reduce that. And so a good multi, high in B vitamins, and be sure to have the quality up there as well. Talk to somebody who's knowledgeable in the industry about that. Chromium, particularly chromium percolinate or GTF chromium, 400 to 600 micrograms, helps lower the blood sugars and also improves insulin's efficiency to be delivered into the cells. Very important. Most of my physicians locally